Well, doctors and patients alike are singing the praises of cancer treatment that uses the patient's own immune cells to fight the disease. Medical reporter Lorie Johnson introduces us to a man who's been in remission for 11 years.
75-year-old Doug Olson has good reason to smile.
I feel great.
11 years ago, doctors told him the treatments they'd been trying for his potentially deadly blood cancer, chronic lymphocytic leukemia, failed.
Terrified is probably the best word to describe it.
Feeling he had nothing to lose, Doug agreed to an experimental treatment developed at the University of Pennsylvania called CAR-T therapy. It uses the patient's own immune system, specifically the T cells.
Your blood comes out of one arm, goes into a machine that takes out your white cells, and then the rest of your blood goes back in the other arm.
Scientists take the cells they removed and add receptors that allow them to bind to the invading cancer cells and kill them. These modified T cells are multiplied in the lab and then infused into the patient.
We use my own white cells to kill the cancer cells, but it was brand new. They'd never done it before in humans. I'm sort of an eternal optimist. I figured, what the heck, worked in mice, maybe it'll work in me.
Did it ever? Just 5 weeks after receiving the treatment, Doug's doctor gave him amazing news.
And he said, Doug, we can't find a single cancer cell in your body.
Doug's success paved the way for thousands to be treated with CAR-T therapy. Now, more than a decade later, he's still cancer-free, showing drug companies and other scientists that continued research could pay dividends.
We feel pretty good about using the word cure now.
Basically, that's a game changer.
So far, the FDA has only approved these therapies to treat blood cancers like lymphomas and leukemias, as well as multiple myeloma. It's usually done at academic medical centers like Duke after other treatments failed.
Their outcome is about 45% for 5 years now. These are the latest studies that showing that the duration of response is extending and actually is not coming down. So I think eventually this will be a cure.
While CAR-T therapy has proven successful for certain types of blood cancers, it has not shown to be effective against other more common cancers, but that could change.
Cancer researchers are currently conducting trials to treat some of the deadliest forms of the disease, including pancreatic and lung cancers, as well as brain tumors.
This is only the start. CAR-T will expand more and more to different indications, including more leukemias, including actually other types of cancer in the solid tumor.
So while cancer is America's second leading cause of death behind heart disease, cancer deaths have actually fallen by more than 30% since 1991. Experts say the decreased death rate is due to prevention, such as not smoking, screenings like mammograms, and treatments such as CAR-T therapy. Lorie Johnson, CBN News.